Optimizing Telehealth, the premium resource for evidence-based strategies to enhance telepractice today, brought to you by the Telebehavioral Health Institute.
Welcome. I'm Dr. Marlene Mayhew, and I'm here with my co-host today, Dr. Shauna Wright. We are very happy to be bringing you the first in a series of podcasts that is called Optimizing Telehealth. We'll be focusing on effective strategies for managing Zoom fatigue, and this webcast is focused on evidence-based strategies for telehealth professionals and consumers. You can get continuing medical education or continuing education for each episode, and you can get information at https optimizingtelehealth.org. So the first thing we'll talk about is our learning objectives for today. We'll be talking about the evidence base related to Zoom fatigue, or what is more known as technology fatigue in the literature. We'll be talking about some strategies to combat Zoom fatigue, and those will include how to arrange our desks. We'll be talking about hardware and software combinations, and some quick and easy documentation tricks that we've learned over time that makes telehealth a whole lot easier than if we're using our traditional soap notes. And then we'll also talk about assistants and how to include them if you want to start working with assistants or if you already have assistants. And we'll be talking about self-care. Dr. Williams had not seriously considered telehealth in the past. She is a child therapist who works in a hospital setting with children who were born with spina bifida and their families. She has to work with a fair number of rather complex assessment instruments and had never contemplated how to do this through telehealth. With COVID, she felt thrown into the deep end of the pool. She was unprepared. She was overwhelmed and anxious because not only was her own caseload at stake, but also her livelihood. She had to figure this out pretty much in just a few days. And because she works in a hospital setting, she also had to coordinate with other people who are trying to get set up themselves, so on her team. So this was a very difficult task for her, and she was very anxious about it. And most of all, she's very concerned about how she could do the same functions that she was normally doing in her life with people that now depended on her for their care during this time of emergency. She was given inadequate direction at work. Her hospital was unprepared for the behavioral professionals in the community to adopt telehealth and interact with other professional groups that they typically work with in a community area. And she was getting conflicting resources when she went online to her professional association and other resources that she could find. She realized that there were legal and regulatory complications that were beyond her, and she just didn't have the time trying to deal with her own family and her own setup of her technology and managing her clients to try to figure out the nuances of what's legal and not legal. She was unsure of which platform to use and which equipment to buy. She realized that her desk setting, her whole setup, is very uncomfortable for the kind of work that she needs to do. And she now feels the need to double back and reconsider what will she do in the future with telehealth, given that the pandemic is going on for longer than many people anticipated. And she realizes that some of her clients and her patients really enjoy working with telehealth. They appreciate the convenience of not having to go out of the home to get care for their families. And so she's thinking maybe she wants to do at least some of this long term. She has seen the term Zoom fatigue in the literature and is thinking maybe that's what she's going through. So now I'm going to ask Dr. Wright, Shauna, to have a discussion with me about this. So Shauna, could you talk about the definition of Zoom fatigue and the contributing factors that you found?
Absolutely. So when we look at Zoom fatigue, we're told that this is really a new phenomenon. And as Marlene and I chat here today, we might learn that maybe it's not so new, but we've heard a lot about it here in the media lately because professions across the board have translated their work to televideo in many different ways. So what we're hearing about Zoom fatigue, it's an overall tiredness. Sometimes there's a worry or an angst that goes into using televideo technology to maintain your workload. We're seeing some reports of burnout associated with the volume of work that's transitioned to televideo communications. So basically, it's that fatigue that people are feeling associated with using virtual platforms for communication. And when we look at, there are so many theories as to where does Zoom fatigue come from. There are some that suggest that there's an auditory component, right? That in-person communication, the sound and the words that we speak match up with our lips moving they're very in sync. Sometimes there's a delay and we have to do extra processing. There's also some concern that we're missing out on nonverbal communication. And we all know that nonverbal communication is such a huge part of how we communicate with others. But with televideo, we have a limited frame, and sometimes we're trying to figure out those nonverbals without the support of seeing someone in person. So there's some theories that, our cognitive functioning is almost in overdrive sometimes when we're using televideo communications. Also, we might have some visual strain, depending on how bright our screens are or how well lit our room is. We may have visual strain that can contribute to that fatigue. Hopefully, the next area I speak about isn't as predominant in healthcare and behavioral healthcare professionals, but what we're seeing in other professions is that when they have their Zoom screens or their televideo up, they're multitasking. They're not just attending to their meeting, but they're doing things on the side, and that multitasking can be fatiguing. And the other thing that's coming up for healthcare professionals in particular is they're sometimes feeling that they're performing multiple roles. They're the provider and they're also the IT specialist to get their patients and their clients through their appointments. So there's a lot of things that can tax us, definitely, and contribute to the fatigue we feel when we transition to telehealth or use a Zoom platform.
The other side of that too, Shauna, that I'm seeing in talking with a lot of people here in our training institute is that many clinicians have not learned how to prepare their backgrounds. So the stimuli that people are being exposed to is rather complex or different than the image that they had of the person that they dealt with. And I think that creates some sort of jarring effect of who is this person? What is their world? What are those sounds I hear? How come they can't control that on one hand? On the other hand, their clinician may not know how to properly position their equipment so that all you see, for example, is maybe their nose and their eyes and a fan circulating overhead. And then you're supposed to be having a conversation, an adult conversation with somebody who's clearly not looking like a normal human being. And so our brains are trying to adjust constantly. And that can lead to a lot of strain for the recipient, you see, as well as us when we work with people, if we don't know how to adjust them and how to have them maybe move their laptop cover or position their phone or whatever they're using in a way that, we're kind of eyeball to eyeball here and talking with a rest of a body attached to what they're seeing.
Marlene, something similar happened to me just today. I saw a client this morning and she was in her same usual space, but she had decorated for Halloween. And as I started our session with our normal opening protocol, everything was fine, but she had decorated a skeleton behind her and put a hood over it. And although I hadn't attended to it right at first, as I'm talking to her, I'm aware of a figure behind her all of a sudden, and it startled me. So those types of things having a startle reaction while you're with a client can definitely affect your sense of well-being and your fatigue throughout the day. So I'm so glad you brought that up, because helping our clients stage their background is very important in managing our own kind of sensory perceptions and how we get through a session, for sure.
Shauna, would you talk about the evidence to support the idea of Zoom fatigue in the literature?
Absolutely. Now, one of the things I want to point out here is that the Zoom fatigue vernacular, that term, it's really fairly new. And it's because we've jumped on to telehealth and televideo at such a large degree. However, our previous telehealth research this hasn't come up as a phenomenon. And I think in part that's due to the fact that a lot of the telehealth research we have is very specific. It's time limited, right? Most of our telehealth research comes from professionals that have a balance of in-person and telehealth work. And so when we look at what does the research say about fatigue with technology, we really, to go backwards prior to COVID, we have to look into a lot of the industrial and organizational psychology to look at how does interacting with technology affect our fatigue and our resilience as providers. So we have a few research articles mentioned here, and we're just going to try to generalize from what we've learned prior to COVID. I'm sure there's going to be a lot more research about Zoom fatigue and technology fatigue moving forward, but let's just take a quick look back. If we look at Balsi's work back from 2003, what they did is they looked at workers and they looked at their work rest schedules for workers who did a lot of work through video display terminals, right? And they tried to figure out what is the best work to rest ratio to keep, our workers healthy, because they found that their video display terminal workers had high incidence of musculoskeletal problems, visual fatigue, and just overall job stress. And what they really found is for every 30 minutes that someone is in front of the screen, they should be taking the optimal work rest schedule is 30 minutes on, 5 minutes off, and maybe even building in some microbursts of movement or exercise between those work periods. And I think that's something that's very important for our healthcare and behavioral healthcare professionals to keep in mind, that there does maybe need to be a balance between how long we're in front of that screen and how much of a break we take. And if we look back at Barber's work, they really looked at working in the home, right? Individuals that were doing work through information and communication technology in their homes, and how that exposure to technology could disrupt sleep. And what they found was that the workers who really set firm boundaries in terms of how they used technology and how they used it for work were less likely to have disrupted sleep. So when you're working from home, sometimes our work responsibilities and our home life, they can kind of trend together, and we may not have clear boundaries. And that means we may not be recuperating and getting the rest that we need. So their study found it's very important to have work boundaries, especially in terms of how we're using communications technologies, and that maybe after a certain time of day, we're not answering emails just because we conveniently can, that we're not engaging with video just because we can or we feel like we'll stay caught up, because it can be very disruptive to our sleep cycles. And the last one that I picked here, I was hoping that you'd help me out with a little bit, Marlene. The Kim's research really looked at cupping. And I know that's something that you have taught others to do in terms of self-care. But this study found that those who have that video display terminal as part of their work life really benefited when they engaged in cupping and mild exercise in terms of their overall physical health when they spent several hours a day in front of the screen. Would you mind sharing with us how cupping works? I know we're going to talk about self-care a little bit later, but it's really important because this research pointed out how important it was.
I've done a lot of computer work, and so I've worked on this quite a bit myself. One thing is to look at my monitor and then look out an open window if I have access to an open window, and then back at my monitor and back out. And the further away you could do that, if you have a viewpoint in your house, it's just a good idea to look out the window every now and then and sort of exercise your irises and your pupils, and just make those little muscles in there work, because they do get frozen in time, over time. And then you experience eye strain. And if you just work them a little bit, it's like any other muscle, then it just keeps everything kind of lubricated. So the cupping idea is to put your hands over your eyes and lean forward. I'm kind of set up here, but I can't do it. But put your eyes into your hands and lean forward, and experience your eyeballs, if you can, falling into what you can imagine to be black velvet. Just really, 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 really soft, cushy black space. And you'll find that deeply relaxing to the inside muscles of your eyes. There's those kinds of things. The last one that I do is I'll close my eyes, and you can do this with me if you'd like, but look up sort of as 12 o'clock on a clock, and go to 1 o'clock and 2 o'clock and 3 o'clock, 4 o'clock, 5 o'clock, 6 o'clock. And as you do that, you go all the way up, back up to 12, If you see that your eyes are sort of jagging down, skipping an hour or two, then you need to work that more. So just keep going back and work that edge, because what's happening is you've got muscles that are kind of taking over in there. You're not doing the full rotation internally with your eyes closed. So these kinds of things you can do to keep your eyes fresh and alive. Okay. Would you talk about what the other options are in addition to what people are calling Zoom fatigue, what other factors might be?
Absolutely. And I know that you were a great mentor to me when I stepped into telehealth, more than a decade ago, because I told you I was feeling this fatigue. It's not new, but I really feel for the providers who are experiencing it right now, because I don't think it's just Zoom fatigue, right? We want to take a step back and look at the whole context. Just universally, we're experiencing maybe pandemic fatigue. So there are a lot of things that we want to look at in terms of why are we fatigued, because we care for ourselves and we adjust to what we need based on what those causal factors are. So we really encourage providers to look at the context. Am I feeling fatigued and taxed in other ways, whether that's financially, workload, stepping into a new area that I've never practiced before? There are so many different levels that can contribute to that. So we encourage you to do a self-assessment. What is causing my stress, my burnout, my fatigue? Being on camera all the time could definitely contribute to that. And that's why Marlene and I are here today to talk you through how to care for yourself and make adjustments. But we also want you to recognize that there might be contextual issues that are compounding that fatigue that paying attention to could definitely benefit you in. And another thing that we really encourage looking at is your screen time fatigue. Once you're done working, how much time are you spending in front of a TV, whether that's television, your phone, a game you might play, and are you giving yourself a break before bed? Most professionals recommend an hour with no screens on before bed so that your brain can settle down and get the restorative sleep that it needs. So yes, maybe it's Zoom fatigue, but we need to do a full assessment and take care of ourselves probably on many different layers.
I'm seeing a question here about moral fatigue because that's on our slide. I do want to address this moral fatigue issue because some people haven't heard about it, but it is the experience of having to make a choice of which none of the options are good. And so many of us have gone through that with the pandemic, is what's the lesser of these multiple evils? I have to choose something to go forward, but I don't feel good about any of them. And that does create conflict. And when we sit with that over and over and over again, client after patient after client, it can wear on us. And so now the literature is talking about moral fatigue. If you're interested in that, I encourage you to go look it up.
So Marlene, can you tell us, are there things we can do to prevent or mitigate this technology or Zoom fatigue?
Well, of course, because I run a training institute for telehealth, I need to talk about telehealth training. There are many questions that people come in with that once they get answered, they feel much more comfortable, much more confident and competent in delivering telehealth. So I think people will definitely be fatigued if, for example, they get thrown in the deep end of the pool like Dr. Williams and they don't know how to swim. They never learned how to swim. Other people may have already begun swimming in the shallow end of the pool and need more advanced lessons. But I think what's happened is many people were just forced to do it. We just did a consult for a group that the director of which 700 clinicians in this group, he said we had scotch taped together our program. We just had to do it. And so we did it, but we know it's not right. And so we need some help to pull things together and make sure the documentation's right and our workflows are appropriate. So that workflow management is crucial too. You may have had the experience of having to deal with colleagues and nobody really knowing what to do or how to do it, and hopefully you figured some of that out. But I want you to know there are many workflows that have already been determined, already been shown by the literature. And because this is an evidence-based discussion, I want you to know that the literature does talk about that, and training will allow you to get that quickly, or you can go look it up in the literature yourself. Okay, either way, I encourage you to find out what other people have done over the years, because telehealth is nothing new. It was started in 1959 in our country, in the United States. So there really aren't too many mysteries about it, but the information about it is not that widespread. And what is out there is a lot of conflicting information that frankly is not too well thought through or isn't evidence-based. It's people's opinions, okay? So the other thing that can really help you is learning how to prepare your client and your patient. Having some skill at what to do if a variety of situations keep coming up for you and surprise you. So you're trying to manage your own visceral reactions to things, but still, maintain your presence with your client on video. These are the things that are hard if you don't know how to go in and say, hey, could you please go put a shirt on? Could you please close that door and lock the door behind you? That kind of thing where you empower yourself to be in charge of the session. So we have a 3-hour workshop on exactly that at our institute because many people don't realize there's a lot that we can do to maintain control of our sessions. Also, many people don't have an ergonomic workspace. Their desk is not set up right, their chair's not set up right, and they're straining themselves and they feel the pressure at the end of the day. And self-care, of course, we've touched on a little bit, but there's a whole lot more related to that as well. So, Shauna, let's talk a little bit more about preferred or optimal telehealth workflows.
You bet. Now we can look at the literature again here for recommendations, but I'm going to tell each and every provider this is individualized, right? So you need to figure out what fits your balance best. How much in-person versus how much telehealth? Do you feel more energetic and able to engage in telehealth early in the day, or is later in the day better for you? So again, that individualized, approach and fitting it to the provider and their sense of energy through the day is really very important. And I think what we're going to find as we continue to go into the future with telehealth is that most providers are going to find that balance between in-person and telehealth care. And typically providers prefer to have a telehealth space. This is when I do my telehealth appointments, so that they're not switching back and forth throughout the day, but they put it together in a space. And when they are on, they feel connected to what they're doing and not that they're bouncing back and forth. Building in time between sessions to get up and move, to walk, to use the restroom. Very, very important to do some of those just basic self-care in between appointments. And we're going to talk here a little bit about optimizing your record keeping and your documentation. One of the things that I've started doing, we're going to talk about, is contemporaneous charting. But really, what we've seen across the board is telehealth has increased our productivity and our clients' access to treatment, which then, of course, means we're doing an increased amount of paperwork and documentation. So we're going to talk about that in just a minute on how to optimize our record keeping. Now, we want you to pay attention to that. So as we talk about some of those issues, Marlene, we've talked a little bit prior to how to prepare our clients, but can you give us a little more detail? How does preparing our clients for telehealth and orienting them to telehealth help reduce our stress?
Well, the foundation is the informed consent process so that we know how to discuss it and not just give people a pile of papers to sign, and how we can use that particular document to protect us and our clients and our patients from undue emergencies because they're not prepared or we're not prepared. And then routines and expectations, having thorough discussions about that, crisis planning. What are the steps you're going to take before you call me? And here are the steps I'm going to take after you call me in the time of an emergency. So being crystal clear about all of that. And then establishing their space, helping them establish their space, because some people cannot find a place to be alone and it's very stressful for them. So allowing them to dictate some of that, but also coaching them through it.
And I know you've talked about this, but let's jump in a little bit deeper. How does that professional training prevent fatigue when we connect by telehealth?
Well, a lot of people don't realize that competencies have been developed for this field. Actually, I chair the committee that came up with competencies for telebehavioral health. And by telebehavioral, I mean everything to do with mental health and substance use, which now is considered behavioral health by the U.S. federal government, and the ways that we interact with mainstream healthcare as well. So there are a lot of different things that have been identified that people really would do better if they knew that. We have information available for that as part of this training that is in the library that you have along with this course. So there's a folder that you can open up and you'll see the documents in there. it also includes supervision and consultation and getting that kind of support when you have a question, and not just going to a colleague who's just figuring it out as well. Because if you don't know it or they don't know it and you're making it up, then there really is not evidence-based care, and it's not professional service delivery. So getting the right information from the right people.
Marlene, what would you have to say about that for those that are mid-career or even later career? Sometimes we don't think about supervision or consultation because we've been practicing so long. How do we get over that hump of seeking consultation or supervision if we feel pretty experienced in what we're doing so far?
I think you have to ask around. Maybe your professional association has a group that's focused on telehealth. You can certainly come to the Institute and you can see what we're doing, but we have a lot of activities that involve the community. So you can see people's names there and you can contact them privately online. You may see somebody's name in a forum that we have here. There may be a number of ways that through the internet, of course, that you reach out to try to find other people that are like-minded. They're trying to learn these things and be responsible just like you.
I mentioned earlier contemporaneous note-taking. Now, I will tell you, if through televideo you're going to take notes while you're with a patient, tell them what you're doing. So I do contemporaneous notes, but I do it at the beginning and the end of the session. I open up my chart, I do my mini mental status exam, and I type it in and I let my client know, I'm doing this, I'm making note of how you're doing so we can follow up at the end. But it's so time-saving to do some of your charting and note-keeping while your patient is in front of you. Talking with your EHR developers or anyone that does that technology for your documentation to put in dot phrases or smart phrases or check boxes that help you slide through some of the regulations that are required for telehealth documentation can, again, be very, very life-saving, time-saving, life-saving as well, I guess, if you're seeing a lot of patients. But don't be afraid to have those conversations with those EHR developers and let them know what you need. And I think we're going to step into our next slide here, Marlene, where you talk about how to organize some of those notes.
Some of the forms that we've created here at the Institute for people that are interested in learning more about documentation. We have a documentation course that's dedicated just to this. The idea here is to make your own if you need to and just have a whole bunch of boxes. So your mini mental could be right up top. You know, you can have check boxes, homicidal, suicidal, and if it's yes, no, right? So you can just quickly move through with a matter of just a few checks, taking a lot of notes rather than writing everything out longhand. Telehealth documentation is more intense. We do need to document more things, time in, time out. Was it an interruption? What happened during the interruption? Those kinds of things. So with that, Shauna, let's talk about some of the hardware-software combinations to reduce Zoom fatigue.
We've talked a little bit about the mechanics of that, so I'm going to start with that. But we look at the brightness of your screen. Where are you positioning your speaker and microphone? Everything to make you as comfortable as possible and not overtax your senses is really very important. One of the other things that I really encourage providers to do, especially as some of our first contacts with clients or patients are virtual now, is to really make sure that you have an opportunity to interact in a technological way with your patients that is HIPAA compliant and secure. And so looking at patient portals, I think we're looking at patient portals more and more now as some of those first contacts are happening virtually and online. And that patient portal can give us access to getting that intake paperwork done, to collecting the documentation that we need to authenticate the identity of a patient. So if you're not using the patient portal where you can have back and forth communications and you can collect the paperwork you need, I really encourage you to explore some options there. Other things that we look at, of course, is how large is your screen, what can be seen on it. And now as we back up to those hardware and software combinations, we want you to very wisely pick some of those out so that they're convenient and effective for the provider and have ease of use for the patient. I think you're going to talk about that a little bit more here, Marlene.
We write a blog every week here at the Institute. We have several blogs actually, and one of them that we wrote in July was how to use your TV with just a simple little cable that you can plug into your laptop so that you have a really big screen. And there are lots of combinations like that we'd love to talk to you about, but it takes a little bit of time. So we have a blog post and you can read that if you want. You have to go to Telehealth.org/blog for that. And just type in Apple TV, okay, in the little search box.
And as we look at kind of our workflow functions, Marlene, what kind of functions in our world can be managed by an assistant? What have you found there?
There are lots of people that have worked with us at the Institute to try to figure that out because they want to maximize their own clinical time and see if somebody else can help them. And educating consumers prior to meetings is a big one related to that. So you could develop a handout, or you could develop little videos if you're prone to that, or have a discussion that your assistant can have discussions to kind of walk people through it and answer real basic questions about how it operates. Of course, if you have an assistant doing that, then you need to document that you train them and that they've signed a BAA, a Business Associate Agreement for HIPAA. But there are lots of different things that are very, very helpful that you can include them. So I just want to encourage you to start thinking about how to be creative with that. So Shauna, what about considering the workspace?
So there are lots of things we need to consider, particularly if we're working from home. So I'm going to target if you're working from home because it all applies to a brick and mortar office as well. But we have to pay attention to external factors, particularly if we have housemates that are with us. How do we ensure privacy externally? Do we need to put a sign on the door? Do we need to train the people in our home when to respect that privacy and not enter? If we can we put a lock on our door when we're seeing patients and clients to really avoid any intrusions? The ergonomic factors, and we're going to step into that a little bit later today as well, are hugely important. The size of screen that you pick, the way you position it, the way you position your office materials, what's within your reach, and how comfortable even is your chair. We're going to give you an example of that later. And then, of course, we want to look at technology. We want the technology that we use to be easy to use, easy to understand, and easy to be guided through should we need technical support. So those are really high-level factors that we want to look at to make sure that your telehealth experience is as smooth as possible. And again, lots of resources for that, both online and at the Institute. Marlene, we've talked about this a lot, but what are some of your favorite self-care strategies? What do you recommend?
Regular breaks and exercise. There's a tremendous amount of benefit from just getting up out of a chair. And a lot of us don't realize that when we're in practice, we get up regularly. We go to the waiting room, get somebody, or go to a lunchroom and, grab something to drink. So when we're seated in front of the monitor all day and we don't do anything but minimal motion, then there can be problems. And Shauna, I remember when you told me about this a decade ago, when you first were getting started, you were getting cramps in your legs. At your age, you were getting cramps in your legs because you were seated there all the time. So getting up, running around outside, I live on a pretty steep hill, just walk up the hill 5 minutes to come back down. There's a 10-minute walk that gets a lot of blood pumping. The idea is to get that blood pumping. And then, of course, monitoring screen time when you're not working. Mindfulness meditation is a trick that I'll be talking about in the next segment here. But there's a lot that can be done that we can learn to control our own autonomic nervous system and not feel overwhelmed literally in the face of people who are telling us about their overwhelm. So a few minutes of that, even closing your eyes, even doing that cupping exercise, very slow things to interrupt the constant bombardment to our nervous system they're very helpful. Also, have professional connections. A lot of us are used to working in offices where you go to the lunchroom, your colleague is there, you've known this person 10, 15, sometimes 30 years, and it's a comfortable thing. It's a fun thing, and we miss that. So we may miss our office mates. I encourage you to set up a time where you can hang out with them. It doesn't have to be an hour. It can be 15 minutes. 15 minutes of a weekly office connect time could really be a lifesaver for you. So see if you can just hang out with some people that you like to meet when you're at the office. And then your vacation, you can make it a stay vacation wherever you live. I happen to live in San Diego, so stay vacations are pretty fun. But go visit the tourist places. Go do something that you otherwise would not do if you were just having a regular weekend. So go try to keep yourself safe, but do something a little more extraordinary. So we're going to talk a little bit about telehealth around the world. There are international teams that have much to teach us about using telehealth, and some of these international interprofessional lessons are the best. There's very easy literature that you can find online for free, by going to Google Scholar. If you've not done that, you can go to any search engine and type in Google Scholar, and you will see that there are many articles there that you can search. Put in my name and you'll see there's a bunch of articles that I've written, textbooks that I've written, and then you can see anybody else that's offering you training and see what's their history. What have they had peer reviewed in terms of their work? And so that's in any field, not just in the telehealth field, but Google Scholar is a pretty good resource. There's also PubMed, which is the National Library of Medicine, and they're publicly funded to put information out there, and there are many high-end journals are available there, and there are many gateways in, but just look for PubMed and that'll get you in, and you can just, once again, search for articles. If you're not familiar with ResearchGate, it is a newer service now that somebody figured out to have researchers talk to one another. You search for a researcher's name there again, and you'll see lots of different information come up, and many of the researchers do share their articles through ResearchGate, so you can get the original article without paying for it through a publisher. And then, of course, traditional libraries that most of us have had when we go to school. I'm going to give you one example. One is a US and Italian-based study by a number of professionals that the study is called Mindfulness, Compassion, and Self-Compassion Among Healthcare Professionals, What's New? A systematic review. I'm reticent to pronounce the names of these clinicians, these researchers. They're rather difficult, but I'll give it a try. Conversano, Ciaccini, Oru, Di Giuseppe, and Gemignani, and Poli. Right, so 6 researchers got together on this team to produce this. And what they're looking at is mindfulness in us, in the clinicians, okay? The publication is Frontiers in Psychology, 2020. This is a very recent article, and the information is available in our materials. And what they did is look at 58 studies that looked at mindfulness intervention, compassion, fatigue-related treatment programs for clinicians. And they came up with a combination of a structured mindfulness and compassion cultivation training that may enhance the effects of interventions and limit the variability of intervention protocols. This idea of limiting intervention protocols is crucial in telehealth because, as you know, we can, with our licenses, serve many different types of people, but need to know what the literature says about any group that we want to work with. Let's say spina bifida children, as Dr. Williams, or maybe it's people with dementia or some other type of cognitive impairment, or ADHD children. It doesn't matter what you look for. Strongly encourage you to go look at the evidence base for telehealth and find yourself some articles, because you will see that there are intervention protocols that already have been tested that you can include. And frankly, you need to be including those in your documentation for the work that you do, and not just pinging around with the usual when you're doing telehealth. Try to get some evidence base behind what you're doing and document that. So let's say Jorgensen and Peterson, 2019, said this and that, and I'm going to do that because of this particular client or patient here that I'm working with. So back to mindfulness. It's been defined as the awareness that arises by intentionally paying attention in the present moment and in a non-judgment way to one's own flow of experience. Okay, that's Kabat-Zinn, 2003. So what the study did was looked at what the researchers that I'm quoting looked at studies that combined this mindfulness in with compassion cultivation training. And they called this mindfulness-based stress reduction. It's appropriate for us. And some of the benefits are that it increases emotional regulation, enhancement of cognitive control mechanisms, lower reactivity to stressful situations, so our own nervous systems can be moderated with just a few minutes of mindfulness training for ourselves. And then we ourselves can also be more able to judge situations objectively. That meta-awareness and shift in perspective of ourselves and can influence the difficulties that we face when we're doing things like processing morally relevant situations, sort of that moral fatigue that I talked about earlier, and the stimuli that comes with this, that then can lead to finding a moral action, choosing and encouraging a moral action, not only in our clients and our patients, but in ourselves as we're trying to help guide people. Okay, so there are many moral challenges that are faced by clinicians, and so one of the options can be not so visible. You see, so we don't have a clear path. We really have to choose, and it gets difficult. So we're going to shift now to talking about competencies. And there's an article on competencies that I'm the lead author on that I make available to you here at this URL, Telehealth.org/blog/an Interprofessional Framework for Telebehavioral Health Competencies. And in that article, we, a fairly large interprofessional group, looked at 7 different domains, identified 5 different domains within those domains, 49 telebehavioral objectives, 146 telebehavioral practices that are otherwise known as competencies. So I want to encourage you to look at those. They come in 3 categories. We have 3 columns at the end of that article: novice, proficient, and authority, and the licensed professional is the proficient one. So as you measure yourself against those, do a self-assessment and write it down. You are competent in this, and this, and this, and maybe not so competent in something else, and then go out and get training for that. You see? So the domains are, the 7 domains are clinical, that of telepresence. How can we be experienced as a fully embodied human being here on the internet, and also relate to other people as they are real people here on the internet? How we project ourselves. Technical issues, mHealth and apps, mobile health and apps, ethical and evidence-based information, legal and regulatory issues, practice development. So that's just an introduction to the competencies in the field, and what we're talking about here today has mostly to do with the technical area that I've just identified, and a little bit of the clinical. How do we relate? How do we present ourselves? So those 3 areas out of the 7 are the ones that we're talking about today. So I'm presenting this to you so you can orient yourself and say, wait, okay, there are 7 domains, and now we've just touched on 3 of them. So if you go look at the article, you see how many others you may want to put in your own repertoire. Our next segment is called Tech Talk Time, and we'll be talking about different technologies or products that are related to today's episode. First, of course, is physical stress on ourselves. So you may be seated in a chair that is not designed for you to sit in it for a long period of time. Maybe the elbow rests are not high enough for you. Maybe the back is not contoured. Maybe you're looking down onto your desk into a laptop. And maybe your instruments are too far away from you. Maybe they're too close to you. These are the kinds of things that we'll be talking about. The first thing to keep in mind when you're thinking about your chair is that if you're slouching, then you may very well be experiencing pain in your neck, your shoulders, your elbows, and your knees and your ankles if your feet are not flat on the floor. Your feet should be flat on the floor when you're seated all day, just to give your spine that extra support. Right? If you are too hunched over, then you may start feeling pain in your mid-back as well as the other areas, as well as your low back. So you need to be sitting straight up, and you need to have some cushioning in there in your low back, and perhaps up behind your cerebellum, your cervical spine, to support your neck. Maybe you want to lean your head back for a minute or 2 throughout the day. It could take a lot of pressure off. Our spines react really well to being relieved of the load. And so if you need to, between sessions, you can also go lie down. It's much more relaxing to lie down for 5 minutes than it is to sit up. It's amazing. There's a lot of literature on that. Now, if you look at ergonomics, and if you look at how Shauna and I are positioned here today, we are in the top 1/3 or so of our screens. That's because we've positioned ourselves so that our eyes are at the top of the screen. That prevents you from having to lean over and look down into a laptop all day. Because if you tilt your head forward all day, well, guess what? Your neck's going to hurt, right? If you look up, your screen is too high, well, now you're pinching the back of your neck, and your neck is going to hurt. So the optimal position is you're looking straight ahead as you're talking to somebody. Well, most of us would have known that if someone asked us what's our optimal position. When you talk to somebody, look them straight in the eye, and to have them do the same, position their computers the way that they need to. Now, if you're sitting or you're standing, the same thing is true. You need to have your eyes, the optimal position, is at the top of the screen, the top 1/3 or so in the screen. It's also what you would imagine would be when you take a picture of somebody. Let's say you go to a wedding or something, you're taking pictures of people. Well, you're not going to put their face at the bottom of the picture, right? You're going to put it at the top of the picture. So the other thing I want to show you here is a device called a Boyata, Boyata, and it is something that you can put a laptop in. I put my laptop in it, and then it's easy to have the laptop be at eye level, you see? So you can arrange yourself. Take a box or a stack of books or whatever you need so that you have your computer up so that you're not straining your neck all day. Now with that, let's talk about Dr. Williams a little bit. Shauna, do you want to add anything?
I'll add on the technology. I'll add just a couple of things so everyone knows. When Marlene and I review any technologies, we want you to know that we do not have commercial interest in those. So we're going to find along the way and through this series, we want to share with you what we found, but we don't have a commercial interest or bias in that. We're just showing you what we found and what's been helpful to us. And, depending on how much telehealth you want in your life, you might even do things differently. For instance, I have a screen mounted on a wall in front of me, and it's a huge 55-inch screen TV, and I have a standing desk so I can sit or stand. Again, we want you to individualize the technology not only to your needs, but to the volume of patients that you see. So we'll help guide you through this in an additional series as we move forward with our podcast. But there are many different ways you can individualize telehealth for your optimal health, and we're hoping to help guide you through that. And so that's all I had to add, Marlene.
Okay. So I'm going to do another thing just in terms of a demonstration for you, okay? I mentioned earlier eye strain, and so I need to mitigate that for myself as much as possible. But if I turn my brightness on my screen all the way up maximally, then it puts a glare in my glasses. So I am of an age now that I need to wear glasses when I'm working on the internet. And so if that constant flow of light is straining to my eyes, it also puts a glare in my glasses. But if I simply turn down the brightness of my screen on my end, then it makes a huge difference, not only to the amount of light coming in from my eyes, but also for the person who's looking at me, then when they look through my glasses, they actually see my eyeballs. It's this kind of thing that is an issue of telepresence. It's very simple because most of us on our keyboards have a brightness button that we can, ramp it up or tone it down. And so, Kurt, play with that. See if you can see your screen enough so that you get your work done, but not be, putting so much light in your eyes. You can even check this when you visit your workstation in the middle of the night. If you're prone to do that, then you see the amount of light coming out of that thing. It's really very, very intense. During the day, you may not notice it so much, but your eyes certainly do register. Your brain will register that kind of thing. And the other thing I want to talk about is the exercise that you can build into your day. And that is if you had a flight of stairs in your home. I do. We have a second story here. So what I do is I force myself to go upstairs to go to the restroom every single time. And I drink a lot of water. And so I have to go up and down the stairs. And there's a lot of research to show that going up and down one flight of stairs is heart health in these days where most of us are seated. So it's pretty important, and you can mitigate the strain on your body and your heart of sitting for hours on end if you just go up and down a flight of stairs every few hours. So, restroom breaks are pretty good. Either that or you go outside and just go around the house. You go around the house. It won't kill you, and it'll probably make you feel a whole lot better and more energized. Is there anything else you want to add to that, Shauna?
No, I really appreciate that. They say that sitting for long periods of time in the day can be as detrimental on our health as picking up smoking, right? So we need to pay attention to what we're doing in terms of movement. And I really appreciate that you mentioned staying hydrated as well. And really it's a reminder. I don't know how many of you have been in that situation where you see patient after patient and there isn't self-care. So please take restroom breaks. Take care of your own health and your basic needs. It's essential to avoiding your overall fatigue with the job you do in general, let alone with telehealth.
One of the things that I've also seen people do well is to stagger their appointments just a little bit. So to give themselves an extra few minutes so they can sit here and close their eyes, and do the circular rotations with their eyeballs. One way, go to the right, and then go back around, go to the left. That'll take you 2 minutes. And if you stagger your appointments and give yourself time to do these things, then at the end of the day, you will not be as tired as you otherwise may have been. So it's a matter of what we would tell our clients and our patients if they came in with strain. I think it's important that we do that for ourselves as well.
And sometimes we can build that in, and we'll talk about this in the upcoming series as well, is having our opening protocols and closing protocols to preserve the time frame of that session. Some providers have told me it's been hard to sometimes disconnect with a client or a patient because the time feels different when we're meeting through televideo. So having an opening protocol and a closing protocol for those clients who in person, you might even have to stand up and walk towards the door to wrap up the session, that we can implement some opening and closing protocols. And we'll walk you through that in one of our upcoming sessions as well. But that helps us preserve the time we need for ourselves, for sure.
All right. Well, let's look at Dr. Williams again. Dr. Williams, after some coaching, decided that she would make changes to her workflow. She would ask for support staff and to build in more breaks. She delegated some of her work to an assistant, is what she did. She also reorganized her office to meet ergonomic needs. And in her case, because this is somebody that I consulted with, in her case, what she needed to do was to point her computer away from the door because she had young children and she never was really sure if one of them would be banging on the door, and it just caused her a tremendous amount of stress. So what you can do too is if you have a door or a hallway behind you, move your computer so that, and even your desk, move your desk so that you're not facing that door. It may take some time to plan the room differently, but the amount of stress that is going to have on you internally could be well worth it. And she also started incorporating light exercise and movement in her day. She told me that she used to do a lot of yoga and she'd kind of given it up. But then she said that she had promised herself she'd do 2 yoga poses between every session. And she was really happy that she was doing that because at the end of the day, she'd done a bunch of them. So she was pleased with herself about that. And then she did some mindfulness exercises as well, just kind of some breathing in and breathing out and focusing on what she had learned in her mindfulness training of her own, which, by the way, there are wonderful YouTube videos on that. You don't have to go pay for a big fancy training program if you don't want to. You can learn a lot of things just using the tools we have available on the internet. And then again, there are some very good training programs if you're really into it. But she reevaluated her documentation process because she realized it's what she learned in school. And that was a long time ago. So she decided she'd better up that and see how she could consolidate things in better documents that would be easy, not only for her to use, but also for her to share with other people on the team. And so they got themselves a HIPAA compliant document portal and cloud storage that they could go and get information out of, in and out of for all the documentation. So they've been able to up their game with all of that as well. And then she decided she was going to reduce her screen time before going to bed. A few hours of no screen time where you do other activities is something that's quite novel for lots of people to even consider these days. But it really is something where that wind down time your nervous system often needs it, especially if you've been bombarding your nervous system with digital input all day. So in our next competency-based programs, we'll be talking about tips for telehealth good fit and screening. How do you decide who's appropriate for telehealth? And in our segment after that, we'll be talking about increasing telehealth patient and practitioner comfort with each other and with the technology. All right, well, I'm going to tell you about a few more resources for you. We have a free weekly email newsletter. You can get that by going to Telehealth.org/signup. And we have this particular podcast you'll be able to see through LinkedIn, through Facebook, and YouTube. And segments of this will be taken and put in iHeartRadio, Spotify, iTunes, and a number of other venues that you can listen to different portions. Margie asks here in the chat box, are we giving a course on documentation? Yes, you can find that by going to Telehealth.org/individual. That's Telehealth.org/individual, and there you'll see all our individual courses. So there's one on documentation. It's a 3-hour course, and the forms, all of our forms that we've developed, including the informed consent document, is available in that particular course. We also have packages of courses that we make available through micro-certification programs. So if you're wanting that, you can get that at telehealth.org/training. It's telehealth.org/training. Now we have a few references that we mentioned in this particular course that you want to see. This is the framework article for Telebehavioral Health Competencies, and we have additional references that is in the slide deck. Thank you for participating. Bye now.
Bye.
Thank you for joining us on Optimizing Telehealth, your premium resource for evidence-based care. Brought to you by the Telebehavioral Health Institute. For full information about optimizing telehealth, as well as how to get your 1 CME or CE for participating, go to optimizingtelehealth.org.